Welcome to the Sharing Without Shame podcast, dedicated to parents and anyone else who loves someone in active addiction. Education is a powerful tool in breaking down stigma, fostering understanding, and ultimately helping individuals and their loved ones navigate the challenges of addiction. With Donna Marston, author of Peeling the Onion and Sharing Without Shame. So take a deep breath and grab some tissues as we uncover the stories of love, courage, and unwavering support in the face of adversity, as Donna and her guests share their stories without shame. Because when we share our stories without shame, we inspire others to do the same.
Hello and welcome to the Sharing Without Shame podcast. I'm Donna Marston, your host, and today's podcast is sponsored by Snap Bands. It's behavioral therapy. This is a Snap Band and it has a mantra on it. Mine says blessing, and it's Snap Therapy. You give it a little snap and it snaps you right out of negative attitudes or thought process. If you'd like to order one, go to www.snapbands, that's SNAPPBANDZ.com. Order yours, and in comments, just put Sharing Without Shame or SWOS so they'll know that you heard about it from me. So today I would like to welcome Dr. Rick Barnett, who's a licensed psychologist, doctorate. He's licensed alcohol and drug counselor with an additional master's degree in clinical psychopharmacology. I hope I said that right.
Yeah,
I did. Welcome, Rick.
happy to be here, Donna. Thank you for inviting me on the podcast.
I'm so excited to chat with you. So first thing I always ask is, what would you like to share without shame?
Yeah, and you mentioned that when we were kicking this off today, and I think as a person in long-term recovery from addiction, who as a clinician, also a psychologist, who has found the field of psychedelic medicine and research so intriguing, someone who used psychedelics extensively, almost, and misused them extensively in my active addiction. I think what I'd like to share without shame is that it is possible to use psychedelics in healthy and intentional ways as part of a recovery process. I myself, since I've been in long-term recovery from addiction, 32 years yesterday, actually.
Congratulations.
Long time. And I shared that at a meeting, and several people were like, okay, you've been in recovery longer than I've been alive, which made me feel really old, but in a endearing way. But since I've been interested in psychedelic medicine and research and the potential in treatment, I availed myself of an opportunity to try ketamine twice. As a person in, recovery, total abstinence, sobriety recovery, that was hard. There was some shame associated with that. Like, am I breaking my sobriety? What does this mean for my recovery? Am I going to now go off the rails and off the deep end with an addiction? Sure enough, that did not happen. And also, I was I used, as part of a research project in Mexico, I was a research subject, and I used 5-methoxydimethyltryptamine. That's 5-MeO-DMT, the Bufo alvarius toad secretion. So I used that in January of this year. Also, really don't consider that breaking my recovery or sobriety, but there's some shame associated with it, with all the the learning that I did as a person in recovery, going through year after year of total abstinence and getting my medallions and things like that. It's kind of a hard thing to overcome in my mind. Is like, okay, have I done something wrong? Should I be ashamed of what I've done? And I don't feel ashamed of it.
Good for you. That's awesome. So can we talk a little bit about your addiction, but you're more about your pathway that brings you to where you are today? Yeah, how did you were you doing the work that you're doing now as a psychologist when you were active in your addiction?
No, nope. I got sober pretty young. My addiction, I would say, technically spanned from the age of 10 to 20 years old. So when I was 10, I first started smoking cigarettes. So I had a taste of the nicotine. It started a really nasty nicotine addiction. And then by the time I was 11, I started using alcohol. 12, I started using cannabis. When I was 15, I used MDMA, ecstasy. I used cocaine. I used LSD, mushrooms. And then for the next 5 years, it was just like a lot of alcohol, a lot of weed smoking, and a lot of psychedelics, mushrooms and LSD and MDMA and cocaine here and there. And it really brought me pretty far down the scale of hopelessness and physical struggles, physical conditions, legal problems, being kicked out of apartment houses and homes, and problems with school. Couldn't stay in school. I was struggling to get any work done in college, so I had to drop out of college. And I found my way into a treatment center, thank God, and got into recovery. And I think through that process, I realized that, certainly through my psychedelic use in active addiction, I realized there was way more to the mind than people really understand. And that wasn't just a drug-induced delusion. Like I really felt like there's more out there. And so in a weird way, I think my psychedelic use, even though it was abusive, it was definitely misusing it. It also opened my mind, and it made me interested in the human mind, human behavior, human emotions. So when
Mm.
I got sober, it became pretty clear that I wanted to be a psychologist, and I pursued a path towards too many degrees. Maybe I became a little bit of an education addict, I suppose. Too many degrees, and but it's interesting. I do credit my career to both my psychedelic use as a kid and my recovery from addiction.
Wow, that's amazing. So how did you, when you got your degrees, did you just do like basic psychology with people? You come in, do sessions. How did the therapy with the ketamine come into play?
Well, that came a long time after I started my career. So I think what happened for me was that I got sober. I was able to go back to school. I got an undergraduate degree in psychology. Wasn't sure what I wanted to do, but the path towards becoming an alcohol and drug counselor seemed pretty clear. So I was like, okay, well, since I'm in recovery, I've got my bachelor's degree in psychology. Why not become a licensed alcohol and drug counselor? That's something I know. So I pursued that. And while I was pursuing that, I also decided to go back and get a master's degree and a doctoral degree in psychology on top of the alcohol and drug counseling certificate. And then again another master's degree in psychopharmacology, because so much of our culture, everybody and their cousin seems to be taking a antidepressant or anti-anxiety medication or whatever. So I felt like, well, shit, as a psychologist, I should know what my patients are taking and how it affects the body and other meds that they're taking. And is it helpful? Is it not helpful? How, even though I can't prescribe medications in about 44 of the 50 United States, I do think it's helpful to know about psychiatric medications as a psychologist. So that does tie in with the ketamine. Like I've always been interested in drugs, both as a user of them, but also, as a student of pharmacology. And then when ketamine and psychedelics started to come around in terms of treatment options in 2018, 2019, that was right up my alley. And so I started to pursue training in psychedelic medicine, treatment, research, that kind of thing. So I did that in 2020. And as I finished that year-long training program, I also got specific training in ketamine-assisted psychotherapy. And so I began to offer ketamine-assisted psychotherapy in my office as a new tool, a new option for people, rather than just straight up talk therapy. You sort of combine talk therapy with this experiential component with ketamine. So it's a weird drug. It's a psychedelic-like experience for people. It can be really helpful for some people. It's not a miracle drug. It's not a game changer, but for some people it can be life-changing. For some people it can be an interesting, curious experience that provides some relief for a little while. And for some people it doesn't do much, but it's nice to have it as an option.
So I saw something about like, do they wear something over their eyes when they do this?
Yeah.
What's
Yeah.
that?
Yeah. We usually wear something like this.
Oh, so it's just an eye cover. It's nothing like where you're going to see like
No, you don't see,
intensify
well,
what you
you've got
see.
enough going on mentally with the you're already seeing stuff. So it's to block out any outside stimulus. So whatever emerges from inside your own consciousness is what you're focusing on.
So how does this well, let's say what's the average amount of people that you've worked with that it really helps? Is there like 1 out of 10, 10 out of 10, 7 out of 10
Yeah,
that they get better?
I would say that there's probably about 70, more than 2/3 of people who I've worked with using ketamine will report either temporary or long-lasting positive changes in their experience. So I'd say 70% or so people, at least in the short term, meaning, 72 hours to, 3 to 4 weeks of improvement in their symptoms, improvement in their mood, their outlook on life, to people who really seem significantly changed in a positive way, in a more permanent way from ketamine treatments. I'd say about, yeah, 70%, but there's still about leaves about 30% of people that either it's a total dud, it doesn't do much. It's just like, okay, that was interesting, but I still feel like shit or whatever. And then another small percentage of people who really are very disappointed that it didn't work. It was kind of like their last hope and it didn't work. And that those people are at pretty high risk for continuing to worsen their depression or maybe self-harm in some way. So they need to be monitored. That happens very rarely, but it does happen.
Hmm. And so if that does happen the first time, would you try 1 or 2 more times in hopes that it would shift and that it would be a positive piece of therapy for them?
I don't know. It really depends. I think it's a case by case basis and probably good to, it's always really good to be connected in community with people who, have had these experiences or clinicians who do this kind of work. So you're sort of exchanging notes. Hey, what do you guys think? There's a person here who had this experience. It didn't go well. They're struggling. What do you think about trying another 1 or 2 sessions with this person and sort of feel around for if it's an appropriate fit. I think for me, just intuitively, I think if somebody has a not great experience with ketamine or even a worsening of symptoms after ketamine, I kind of steer away from it. I just say, okay, well, it's usually a one and done. And then we're just like, okay, well, let's look at other options. Keep them engaged, but not necessarily with ketamine. And I tend to do that anyway with folks. There's a protocol with ketamine that most of the research suggests that if you're going to do ketamine treatment, you should probably sign up for like 6 or 12 consecutive sessions, like weekly or something like that, to really, work on changing thought patterns and emotional patterns. And I don't really start that way with people. I don't suggest that they need to sign up for 6 or 12. I usually say, if you're interested, let's try it once. Let's see how it goes. And if it goes well, or you want to continue, then we can set up something more regularly. But I don't start off with like that 6 to 12 sessions to start. Yeah.
So is that a pill that they take?
So ketamine, actually, you can use it in various formulations. The only one that's approved by the Food and Drug Administration is a nasal spray called Spravato. It's S-ketamine, and so it comes in a nasal spray format. You spray 2 sprays per nostril, something like that. Can do more, can do less. And that's one route of administration through the nasal spray. There's also IV, so you get a PICC line in one of your main veins in your arm, and it's a very quick experience. It comes on very fast, it goes off very fast, like 45 minutes. There's intramuscular, so you get a shot in the arm, and that can be about an hour and a half or 2 hours. It's kind of a little bit longer experience depending on the dosage. And then there's also lozenges, and that's what I mainly do in my office is ketamine lozenges that people will self-administer the lozenge. They have a prescription. You put it under your tongue, it dissolves, you swish it around to make sure it gets absorbed through the mucous membrane of your lips and your mouth. And then you swallow it. Some formulations you don't swallow, you spit it out. And people can have a pretty strong experience from the sublingual lozenge formulation for sure. So that's four different ways ketamine can be administered clinically.
So how come, I know there was a senator in New Hampshire who was trying to, I think his child, I don't know if he had a teenager that was doing some mushrooms, and he was trying to get that legalized because, different types of psychedelics can help people in therapy. A lot of this is underground. So why is ketamine legalized, but some of the others that I believe many, many years ago were very beneficial to people, and then they became illegal? I think that it changed. And yet there's so many people out there. I'm hearing more and more, and that it's really helping. Why is only ketamine legal and nothing else? Do you know?
Yeah, I mean, it's a great question. And I think most people would answer that question in part because of the pharmaceutical industry, that there was pharmaceutical interest in developing and pushing ketamine forward as a drug to be sold to consumers for treatment. Ketamine has been widely used in anesthesia for years, but they discovered 20 plus years ago that, hey, this really seems to help people with depression. Why don't we study it and apply for a new drug application for ketamine, not for anesthesia, but in a different formulation, lower dose level for depression. So Johnson and Johnson or Janssen Pharmaceuticals or whatever was able to get the patent on it and pushed it through. Now, psilocybin mushrooms, psychedelic mushrooms, they grow naturally. It's very easy to grow. It's not a very attractive pharmaceutical product for the pharmaceutical industry because it's so widely available. It's inexpensive to grow. It's easy to grow. And also, I think that, we just talked about ketamine as being a 6 to 12 session, protocol, whereas you look at most of the research on psilocybin, it's usually 1, 2, or 3 experiences, and that's it for the treatment of depression or other conditions. It's not like something that you do in an ongoing way. That's not very attractive for some pharmaceutical companies, but they're still trying to develop psilocybin or psychedelic mushrooms into a pharmaceutical product. That may be medically legalized, accessible in maybe 2 or 3 years, but yeah, I think it's partly that. And also, we still live in this drug war era, this stigma around psychedelics, LSD, magic mushrooms, even MDMA. Like some of these drugs were criminalized years and years ago due to the drug war. And there's still a lot of stigma associated with it. So there's a lot of people that think, people are going to eat mushrooms and they're going to jump off buildings or run in the street naked and, do all kinds of violent things, which is so far from the truth that you were just alluding to. Like, there's so many people that are using mushrooms right now, micro doses, macro doses, underground, in New Hampshire, in Vermont, in Mexico, in California. And the fact that they're still illegal, it doesn't make sense at all. It's starting to change in different localities, and in some states they're decriminalizing. We're trying something here in Vermont, but it doesn't look like it's going to go through anytime soon. And Massachusetts has a ballot initiative that may go through in November. A lot of support behind decriminalizing some different plant medicines. So we'll see what happens. But that is something that's slowly changing, Donna. I think people are breaking down that stigma and seeing that it can be really helpful for folks.
Mm-hmm. Yeah. Yeah. Oh, I know. It's really interesting. I think, from what I've seen, I see people and hear about people like moving past their childhood trauma or healing whatever. Like, I think we all have a little kid inside of us that's hurt, right, along the way, and it stacks and stacks and stacks, and you get to a point as an adult and you either self-medicate because you can't stand to be in your skin, or you don't self-medicate because you don't have an SUD, but you might go shopping a lot. There's a way you find that addiction somewhere, right? And we all have it. And and it blows me away, because I think, how, I mean, I've tried some of the medicines. I'm going to be honest. This is the first time I've admitted this publicly, and it was the best healing I have had in my life. And it took me from this wounded kid to like a really healthy adult. Sorry.
Yeah. Yeah, it's powerful.
And it's mind blowing. Like, why aren't we helping more people?
Yeah. Yeah.
I don't know. I don't get it. Unless our government can make a lot of money off of it. I don't know if that's, or if the pharmaceuticals or whatever it is, but I think there's so many people that could benefit, as long as it's done well with somebody who's trained, they know what they're doing, and you're not going to get hurt in the process, right?
Well, that's part of the struggle I think people have right now in terms of just going all in and approving or decriminalizing some of these medicines, is because there's still, not only is there stigma, but even if the stigma breaks down, there's this idea of safety. And safety is so important. So you have organized medicine. Now I'm part of the, Western medical system. I'm a licensed psychologist, and I understand ethics, and I understand public health and public safety, and a conservative mentality around wanting to reduce or prevent harm. So there are people in sort of high positions uh, in medical organizations or government positions who really don't feel that these medicines are safe. We don't have a system yet to offer them in safe ways. So there may be underground practitioners that do great work, but how do we regulate them? How do we really know they're doing good work? We still hear horror stories about things going sideways. And then you even have licensed providers who have been trained in these medicines and this kind of work, and maybe even though they're regulated and stuff, but maybe they run into problems. There are people who do ketamine clinics, and you still have bad actors even in the legal regulated market. The licensed regulatory models where someone has their license taken away because they were not practicing safely and effectively. So the question is, well, yes, these are helpful for people. How do we safely get people access to these experiences? And you look around, and some people will say, well, the underground is totally unregulated, and how can we really know that they're doing anything safe? And then the legal and licensed healthcare providers, first of all, they're not going to be working with these medicines because they're licensed, and they don't want to lose their license because they're using a drug that's illegal. And second of all, even if they were doing it legally, they're not foolproof either. Like, there are still licensed providers who, act in bad faith. So people stumble on that. It's like, how can we create a system that's guaranteed to be safe for all? And the answer is we can't. It is safe in the underground. It is safe in medical settings, and there are going to be harms. And it's not unique to psychedelics. There's harms from overprescribing antipsychotic medications, or even statins or regular medications, and there are problems in the underground. So there's no way to protect everybody from harm all the time. That's just an unrealistic bar. Unfortunately, psychedelics get far more scrutiny, and for no good reason, in my opinion, except that, because you said you've had experiences and I've had experiences. Of course, they put you in a vulnerable state. They put you in an incredibly vulnerable state. So, of course, there needs to be safety guidelines around that. But just because they put you in a vulnerable state doesn't mean that you're more vulnerable, or there's more of a need to sort of like prevent access, because it's like, that's the argument. Like, psychedelics put you in way more vulnerable state than anything else on the planet. So, and there's no way to regulate it. There's no way to produce safety. These poor vulnerable people having these intense experiences. We should just like wait until we come up with a system where everybody's protected 100% of the time. And that's slowing things down quite a bit. It's unrealistic.
Yeah. And there's so many people who need help, and if this can be their pathway to recovery, because I've met some people. I had a woman on my podcast, she'll be before this one, and that was her pathway, and she was shunned from the recovery community. And she had to figure stuff out and navigate her way, and which is heartbreaking, that she had to go through that. And thankfully she managed to move past it and find her way, and has a community that works with and for her doing this form of therapy,
Yeah.
and I'm sure there's all kinds of communities that no one knows about.
Well, there's also psychedelics in recovery. So those
Oh,
people
there
who,
are.
yeah, there's people who come from traditional 12-step backgrounds or abstinence-based programs, and they use psychedelic medicines. And in some cases, like your friend, they get shunned from those traditional 12-step communities. In some cases, there are plenty of 12-step communities that are abstinence-based that accept people who have used ayahuasca or used psilocybin for, it's like an outside issue. It's like, how is it different than somebody who uses a Prozac or a Zoloft for depression? There's people in AA who will say you're not really sober if you're using an SSRI or you're using a anti-anxiety medication. You're not really sober. You're still altering your consciousness. And then there's a lot of people who say that's bullshit. You're still sober. And if you need to use psilocybin or ayahuasca to treat some trauma or underlying condition, that's fine. You're still sober. I mean, are you using it every day? Is it impairing your day-to-day life? Have you turned into an addict again? No? Well, then keep coming to AA. It's great. There's plenty of people in AA who won't shun people, but there is a group called Psychedelics in Recovery that honors the sort of the 12-step lineage, but it's very accepting. It's actually for people who want to find a home base in recovery where they can talk about their psychedelic experiences and also follow a 12-step program.
Interesting. I just had a question, and as quick as it came, it left. I hate when that happens.
Yeah.
Um,
But community is really important. I don't know about your experience, but as long as I think that's one of the safeguards, I think that we can put in place, whether it's medical access to these medicines or underground or decriminalized access to these medicines. I think accountability and community and talking with one another, supporting one another, those are safeguard mechanisms to keep people safe. If something should go wrong or someone doesn't feel comfortable, hey, what do you know about this provider? What do you know about this shaman, this practitioner? Or I went to this shaman and this practitioner and that didn't feel right. Has anybody else had experiences like that? I need support here. So being in community with one another is really one of those, I think, staples of safeguards people can
and,
have.
and so I worked with two different people, and there's a process. It was a meet and greet, and then you filled out a lot of paperwork, a lot of going inside and reflecting of why, about the healing piece, and why a lot of the whys had to come forward. So you had to really look at yourself. And then, for me, I needed to feel safe. And the two people that I experienced the medicines with, I felt very safe. Like, it was mind blowing that how helpful this was, because I would never do stuff like that. That's just, I mean, not that I didn't try when I was a kid. I don't have an SUD. I never liked how drugs made me feel, or alcohol. So, it was a little scary, but, and it's not like it was like, oh, the experience was internal, the internal healing of my heart and the forgiving that came forward.
Mhm.
It's beautiful. And, and I'm grateful and thankful that I was introduced to this, because I couldn't get out of my own way,
Mhm.
and now I can put one foot in front of the other, and loving myself.
Yeah.
And I think that's what it all comes down to, right?
Yeah.
addiction and recovery. It's all about whether it's from an SUD or shopping or whatever, it all comes down to self-love and how do we move forward and heal that little kid that was so wounded, whether you came from a good home or a bad home, we're all affected.
Mm-hmm.
And we can either carry the cart of all our crap, or at some point when we're sick of feeling sick inside, we start unpacking it. And I tried to unpack mine for years. And this was what helped me really unpack it and put it away and not have to go there again.
Yeah.
You know?
Yeah. Yeah. Forgiveness, self-forgiveness, forgiveness of others, unconditional love for oneself, you know, leaning into those experiences and having that come forth in a psychedelic medicine session is so powerful. It really does get down into the roots of a lot of our struggles, and it does so in such a unique and profound way that it makes a lasting difference. And I think also, to your point about having tried to unpack some of these things in other ways over the years, I do feel as though there's a phrase that people say in the psychedelic world, and they're in the hype of the promise of psychedelic treatments. They say this is like 8 hours of therapy, 10 years of therapy in 8 hours, you know, or 8 years of therapy in 6 hours or something like that. And it's like, well, I understand where that comes from, and on some level that is, I can see how that's true. But also I think that therapy in general is an endeavor to understand oneself. And to the extent that somebody has tried through meditation or therapy or other tools to unpack what troubles them, I think that bodes well to have an optimal psychedelic experience. If you're somebody who's never done therapy, never meditated, never tried to unpack these things, and you have a macro dose of mushrooms, that might be really hard because you've never really, you know, been taken down into the depths of your consciousness and tried to figure out what was going on. So to say that it's 8 years of therapy in 8 hours, it's like, well, if it wasn't for the therapy, if it wasn't for the self-exploration, the meditation, or whatever the stuff I've done so far to unpack this stuff, then maybe I wouldn't have had such a profound experience. So I think, and also on the back end as well. So you might have had a profound experience, but it's nice to have a therapist or somebody who is there for integration to support you, to help you continue to work with the new understandings, the new learning, the new appreciation you have for yourself and other people, to keep nurturing that unconditional love and forgiveness, to have, because that's ongoing, right? We can always slip back into the old patterns. So we need to keep working on that. And it's not just therapy. You can keep working on that in a lot of different ways. But I think that somehow psychedelics get propped up at the expense of therapy. Like therapy doesn't work, traditional meds don't work, and psychedelics are the best new thing since sliced bread. And that's not quite the whole picture.
Right, right. So if somebody wanted to get in touch with you, how would they go about that?
Well,
you're in Maine or Vermont?
I'm in Vermont.
Oh, okay.
Yeah, I mean, I'm pretty Googleable, and I'm pretty active on LinkedIn and X, Twitter. So I think those are the best ways for people to reach out over those social media platforms. Otherwise, yeah, I'm very accessible. I have a private practice here in Stowe, Vermont. I have a ketamine practice here. I'm definitely accessible through the internet, and so it's possible to find me by Googling me.
So just Rick Barnett.
Yeah, Rick Barnett, psychologist, Vermont. Yeah, all kinds of things will pop up.
Okay.
Yeah. We just had a conference, our third year in a row. I'm the co-founder of the Psychedelic Society of Vermont. In our third year in a row, we had a psychedelic science and spirituality summit here in Stowe, and it was just on the fall equinox. And we have researchers that come from all over the world. They fly into Vermont. They come and speak to us about their research. We have underground practitioners speak to us, leading figures in the psychedelic space. But mostly a lot of people from, all over the country come into Vermont, and we just get together and commune with one another. There's no there's no overt drug use. It's not, we don't come together to trip, have ceremony with psychedelics. It's really it's a professional conference. It's all healthcare practitioners, but it's really a special event. Again, that just finished up this past weekend, and it does speak to community. And I'm partly bringing that up because I think you might see some social media posts more recently about the conference, so you'd see some pictures from that. So you can find me online.
Cool. Awesome. Well, thank you so much. This has been great. I, love talking with you and getting all this information, and, you know, I wish you the best.
Thank you. Thanks for having me on the podcast, and keep it up. I love it when people start their own podcasts and try to get the word out about important topics. Sharing without shame is so important. Shame is such a huge thing in therapy and doesn't get talked about enough, but a lot of people live with a lot of shame, and it's not healthy. To get it out, you're only as sick as your secrets, like let it out, talk to people about it, decrease that shame. It's like a huge weight lifted off people. So thank you for doing what you do.
You're welcome. Thank you.
Thank you for tuning in. If you'd like to support the Sharing Without Shame podcast, please subscribe, like, and leave a review. If you're in need of emotional support, Donna offers private sessions. For more information about Donna and the services she offers, visit www.sharingwithoutshame.com or email her at Donna4support@comcast.net. Nothing in the Sharing Without Shame podcast is intended to establish a therapist-patient relationship or intended to replace the services of a trained therapist, doctor, or health professional, or substitute for professional mental health, medical advice, diagnosis, or treatment. Until next time, may your faith and strength heal your heart.